Yes. Oops. Yes. All right, so this is my research presentation. My name's Pranav, and I'm 16 years old, and this is my first year in ISM. I am studying surgery this year, and basically I got into the field of medicine as a whole from a really young age. I come from several people in my family are doctors, and so I've just been constantly exposed to that field, and it's just been really a big part of my life since I was small. And so I've always enjoyed science, and I truly believe that this is my calling. And I think it's such a noble profession because you're out there and you're saving lives, and you're the reason that some people get to go home and see their families. And to me, that's priceless, and that's why I want to be a part of it when I grow up. And so that's why I'm in the ISM program, because I feel like it's a great way to get my foot in the door and to help me learn more about this field that I want to go into. And so I found out about ISM from Sarah Meeks, and so she told me about it, and she was like, "It's the best class I've ever taken." And so I was like, "Sign me up." So then I did. And I just think that so far it's just been fantastic, and I've learned so much, and I can see that it's boosted my confidence a lot, and I'm no longer I'm not that shy anymore, and I just think it's absolutely fantastic. And so those are some things that I'm involved in school and outside of school. And so my quote is, "Live as if you were to die tomorrow, learn as if you were to live forever," by Mahatma Gandhi. And the "live as if you were to die tomorrow" part, it really makes you think about, if you were to die tomorrow, what matters and what doesn't, and it gives you a good sense of priority on how to live your life and do the things that actually matter. And the "learn as if you were to live forever" part, that's that's really applicable to the field of medicine, because things are constantly changing and evolving, and there are constantly new techniques, new drugs, new procedures and all that, and you constantly have to remain updated, and you have to just keep learning. And I think that's very critical to the field of medicine as a whole. And so first I'm going to do my research assessments. My research assessment 1, it was rapid granulation tissue regeneration from ATP delivery, and basically what that means is this treatment was developed for tissue ischemia, and tissue ischemia is basically when an area of the body doesn't have a blood supply. And so what that means is basically, for example, in organ transplants and things like that, if you're taking a heart from a donor and you're putting that into someone else, that heart basically has no blood supply, and it can degenerate very quickly. And so basically that can cause severe damage in patients, and that's a really big issue. And so their proposal was to use ATP capsules that have ATP, that are lipid vesicles with ATP within them. And it's sort of like a gel, and you apply it to the ischemic wounds, and it has a much faster rate of regeneration. And so in this article, they had compared it to a drug called Regranex, which is a platelet-derived growth factor. And basically what that is, it's used on diabetic ulcers and things like that. And so the problem with that was they found that patients who used that drug a lot developed cancer later in life. And so they really wanted to find something new that could be applied on a broader range of topics of diseases, and they wanted to not have that side effect of cancer that could come later from that other drug. So, and the results were extremely promising, and it showed a very rapid rate of regeneration. And then the next assessment I did was over robotic-assisted surgery, and it was basically the reason why I chose this article was because technology is such a huge part of surgery, and like I said before, there are constantly new things that are being developed and are constantly being put into and worked into new procedures. And so I wanted to find out more about a machine that had been recently invented. And so this machine is called the Da Vinci, and it's different because there's more independence that's given to the machine, as opposed to most of the time surgeons are the ones that have most of the control. But in this case, the reason why this is so unique is because more independence is given to the machine as opposed to the surgeon, and that can lead to some controversy because people they might not necessarily want to have a robot operating on them as opposed to a surgeon. But the tests have shown that this robot is extremely precise, and it's led to less scarring, less bleeding, and less pain in patients. And it basically, the way it works is it mimics the natural movements of a hand and their fingers, and it's extremely precise, and it's used in urology for removing prostate, fixing hernias, and kidney blockage. And so those are a lot of very prominent procedures in surgery. And so those are some images of what it looks like, and as you can see, it really does. When you look towards the bottom of it, it really kind of looks like it said before, it mimics the hand movements and looks pretty complex. And yeah. So my third research assessment was about antibiotic resistance from bacteria, and basically it was about how doctors are overprescribing antibiotics to patients, and that is leading to increased resistance from bacteria because of they'll prescribe antibiotics just for the things that don't even necessarily need antibiotics. And so they're given to patients who undergo surgery for cancer, hip replacements, pacemaker implantations, and all that. And so basically that's just leading to bacteria becoming more resistant, and that can result in severe damage to patients, because if the bacterial infection goes uncontrolled, they can get very sick and even die from that disease. And so my fourth research assessment, I did it over my UNT trip, which I thought was awesome. I got to find out what the college life was like, and I attended. They didn't really have anything surgery related, but I went to basically the intro to bio classes and a bio major class. I also went to biomedical engineering, which was really cool. In the intro to bio class, we talked about evolution and stuff you'd learn in high school biology. But then in the bio major class, they went really more in depth on female hormonal processes and during pregnancy and just how it changes throughout over a period of time. And so in biomedical engineering, we learned about circuits, and I thought it was an awesome trip, and I learned a lot from it. And then my fifth research assessment was about a rare liver surgery that was performed in a state-run hospital. And basically what happened was there was a man who had a condition called Budd-Chiari syndrome, or BCS. And basically what that is the major arteries that lead to the liver basically develop an occlusion, which is a buildup in them. And this is it's a really rare condition. And there had only been one operation like this done previously, and that was in Canada. And so it was really high risk, and he could have died from it. But basically what the procedure entails is the liver is basically removed from the patient, and the buildup is cleared, and then they reimplant the liver back into the patient. So it's pretty risky, and but they did it, and I thought it was really cool to read about how even though the odds were against them, they still, and the procedure had only been done one other time, they still it was still successful, and the patient survived. And they also did it for free. He didn't have to pay anything to the surgeons for that, and I thought that was really cool. And so my next part is I'm going to talk about my informational interviews. My first interview was with Dr. Robert Minquez, who's a pediatric general surgeon. And so he basically told me about he was a former ISM mentor, and he told me about how he basically loves to take care of kids, and he he just told me about like his daily routine as a general surgeon and everything he does, and he gave me like a lot of great advice on how you have to remain constantly updated, and you're always learning, and you just need to, you're in it for the long run. It's not something that you can just he said it was a marathon, not a sprint. And so I thought that was really great advice, and it really made me think about the field as a whole, and I really enjoyed that interview. My next one was with Dr. Joseph Forbes, who's a pediatric cardiothoracic surgeon at Children's Dallas. And so that hospital was huge. It was really cool to go there and see it. And so he told me about how when you're working as a surgeon on a team, you really have to collaborate and work together, and you can't really just do a solo type operation. And he also told me about how he gave me advice about like majors, and you can major in anything you want. It doesn't have to be a science unless you really want to do major in a science. And so he said that undergrad is like your last chance to learn about something that really interests you. And basically he said that he talked about how he performs open heart surgeries on newborns, and how it's extra difficult on them because they're so small, and then they have a much higher sensitivity. And he just told me about different procedures he performs, and how pediatrics is different to adults. And he said he prefers pediatrics a lot more because he thinks the environment is a lot is more fun, and he just likes to work with kids. And yeah. And my third interview was with Dr. Sean Haslam, who's an orthopedic surgeon at Centennial. And so we talked about how he was trained in Canada. So he told me about how the medical training in Canada differs to the U.S. And he said that medical education outside of the U.S. is it's not too different, but he said that he feels the training in outside the U.S. is in some places is a lot better than training within the U.S. And he also told me about how he recommended getting a residency, which is like specialized training for doctors. And he told me how you should get it in a big city where you see lots of different like scenarios, so that you're better prepared for the future if something comes up. And he talked about like different complications that occur during orthopedics, different orthopedic procedures. Like when he talked about arthroplasties and how the insertion of a prosthesis, an arthroplasty is basically like the surgical fixation of a joint. And he talked about how when the prosthesis, which is like the artificial the implantation that goes into the leg, when that's put in, the results can be that patients have they end up with longer legs. And I mean, he said that basically the size increase is inevitable, but he said you want it to be around like 2 to 3 millimeters. So there will, like after arthroplasties, patients' legs will be longer, but if it's something crazy like 2 inches or something, then they'll end up suing the surgeon. And so he just talked about that and like all the different other complications that show up. And then he also told me about how ACL injuries, the frequency is increasing, and he's seeing more and more ACL tears. And he also told me about how you have to truly have a passion to succeed in this field, and you have to always want to learn, and you really have to love what you do. And then I interviewed Dr. Michael McBride, who's a cardiothoracic surgeon at Medical City. And he told me about how at his practice, physician assistants and nurse practitioners are heavily integrated. And so he's constantly working with his PA, who's a physician assistant, and he basically does a majority of the work for him, which he said was really nice. Like a lot of doctors have to do, they have to do a lot of the things themselves, but having a PA really takes the workload off and allows doctors to focus allows surgeons to really focus on surgery and the recovery of their patients. And then he taught me about coronary bypasses, which are a really cool procedure. It's basically what happens when an artery is blocked in the heart and you take an artery out from the leg and you basically re-implant that artery into the heart, and it allows the flow to continue back through the heart. And so I thought that was really interesting. And he said that the hours he has are really long, but he said it's really rewarding, and he loves to help his patients and keep them healthy. And so here I have my weekly blog, and that's where I talk about my progress and the things I've done and what my goals are. And so, yeah, thank you. Do you have any questions or anything? Oh yeah, my original work proposal. Okay, so basically my idea for that was I'd asked all the doctors like what complications were during surgeries, and so they all told me, like across the board, they all told me that bleeding is an extremely common occurrence that happens. And so I thought that there are different ways to combat it, and there isn't really one set method that really has a definitive way to stop it. So what I thought what I could do is test the different methods and see which one results in the least amount of blood loss, and that way it could show like which way to combat bleeding would be the most effective.